Hello and welcome to the presentation on Core Values of Holistic Nursing, the Art, Science, and Creativity of Nursing, Part 2. I'm Kathy Holloway and I will be sharing this information with you today. As you recall, in Part 1 of the Core Values of Holistic Nursing, we discussed what is holistic nursing. We defined holistic nursing and what the holistic nurse does. We talked about some areas of concern or interest to the holistic nurse, and we discussed core values 1, 2, and 3. In this presentation, we're going to be highlighting core value 4, which is holistic education and research, and core value 5, which is holistic nurse self-reflection and self-care. So let's get started on holistic nursing core value number 4, which is holistic education and research. Holistic nurses possess an understanding of a wide range of norms and healthcare practices, beliefs, and values concerning individuals, families, groups, and communities from a variety of racial, ethnic, spiritual, and social backgrounds. Holistic nurses value all the ways of knowing and learning. They assess health literacy and individualized learning, appreciating that science, intuition, introspection, creativity, aesthetics, and culture produce different bodies of knowledge and perspectives. They help others to know themselves and access their inner wisdom to enhance growth, wholeness, and well-being. Holistic nurses look at alternative philosophies of science and research methods that are compatible with investigations of humanistic and holistic occurrences that explore the context in which phenomena occur and the meaning of patterns that evolve, and take that into consideration, the interactive nature of the body, mind, emotion, energy, spirit, and environment. And finally, holistic nursing core value number 5, holistic nurse self-reflection and self-care. Self-care as a personal awareness and continual focus on being an instrument of healing are significant requirements for holistic nurses. I'm going to repeat that. Self-care, as well as personal awareness and continual focus on being an instrument of healing, are significant requirements for holistic nurses. Holistic nurses reflect on action to become aware of values, feelings, perceptions, and judgments that may affect actions, and they also reflect on their experiences to obtain insight for future practice. Holistic nurses value themselves and mobilize the necessary resources to care for themselves. They endeavor to integrate self-awareness, self-care, and self-healing into their lives by incorporating practices such as self-assessment, meditation, yoga, good nutrition, energy therapies, movement, creative endeavors, support, and lifelong learning. Nurses cannot facilitate healing unless they are in the process of healing themselves. Through continuing education, practice, and self-work, holistic nurses develop the skills of authentic and deep self-reflection and introspection to understand themselves and their journey. It is a lifelong process. Holistic nurses strive to achieve harmony and balance in their own lives and assist others to do the same. This concludes the presentation on the 5 core values of holistic nursing practice. On this slide, I've listed the core values, and I've highlighted core value 5, holistic nurse self-reflection and self-care, because it is probably the most important core value of holistic nursing. Holistic nurses' self-reflection and self-assessment, self-care, healing, and personal development are necessary for service to others and for growth and change in their own well-being and for understanding of their personal journey. This concludes our presentation on the 5 core values of holistic nursing practice. This is the reference, the Dossey and Keegan textbook, and I would encourage anyone to review this textbook because it's an excellent resource for the holistic nurse.